People who are recovering from heart surgery or other cardiac care issues need to take extra care of themselves during the time they're healing. And registered nurse Cheri Nelson is here from Mosaic Life Care's Home Health Department with tips. Cheri, thanks so much for being here.
Well, you're welcome, Bob.
Talk about, first of all, the people you're wanting to address specifically.
Well, it's people that have been in the hospital that have had cardiac diagnoses, whether it's been open heart surgery or congestive heart failure, new diagnosis or an old diagnosis. You know, being in the hospital, you're in a controlled environment, and it's kind of, I shouldn't say easier, but people give you your meals, give you your meds, and when you're home, it's kind of a different ballgame. You know, you're kind of there on your own, especially with heart surgery. You know, people say, oh, I felt better in the hospital than I feel home, and that's pretty normal, you know. I see a lot of those patients, and it is normal to feel worse when you come home. You know, the main thing is to manage it, is to keep track of your meds and take your meds.
Yeah, I think it's probably important to bring up a couple of things. First of all, you probably don't realize how much you use your chest.
You do not.
In just about everything you do.
Yes,
and
yes.
Not only that, but heart problems can happen to anyone at any time without warning sometimes.
Absolutely, it does. And just real quick, I do want to touch on something that to me is a lifesaver, is the $50 test or the calcium score test. You know, to me that has saved lots of lives. In my practice, I see it. You know, it's a great thing. But importantly, when you are home after any cardiac event, you have got to weigh yourself. You know, keep track of your weights. That's one of the first things people notice that have heart issues going on, you know, like congestive heart failure. You know, their weights will come up, they'll notice a little swelling, maybe I'm short of breath, and they kind of just don't do much about it. But those are things that we teach them in the home that they need to keep track of. You know, side effects of medications, you know, people have high blood pressure, they have heart disease, and we get that under control, and their blood pressures are much lower. And so they come home, they may stand up, they're dizzy, and they don't want to take their pills, and so they're non-compliant. So we have to tell them the importance of taking their medicine, following their diet. You know, you don't have to go out and buy a treadmill, just walk. You know, we have feet, set a timer on your phone, and just walk. But there are challenges of being home as opposed to being in the hospital.
Talk more about that $50 test. I'm not sure what that
Well, I'll tell you what, the $50 test, it's been around for a while. We haven't done it a lot. I mean, it's newer in St. Joe than it was in Kansas City. But what it does, it kind of visualizes the coronary arteries, the calcium in your arteries. That's what gives us heart attacks, one of the things. But that is a non-invasive test that can actually detect other things as well as coronary artery disease. You know, it can detect early signs of lung cancer. You know, I've had a few patients that have went in just to have a routine, and their score's been great, but they've noticed that there's other things that are concerning. So that test it's non-invasive. It's really the only non-invasive test that you can do to kind of know what's in your arteries, because you know, a cardiac cath is, of course, the gold standard, but that's invasive and it's expensive. And so you don't have to have a physician.
$50 is a lot less.
And no physician's order. I mean, you just walk in and you say, I want the $50 test. And, you know, it's important for women especially because, you know, women's heart disease is much different than men's. So
you brought up a lot of great points, and I wish we could keep talking about
I mean, I could talk forever about heart stuff. So anyway, thank you.
Cheri, thanks so much for being here.
Thank you very much.
Mike.